Hello, my name is Amanda Wheeler and my master topic is hypertension. First off, I'm going to start by giving a simple explanation of what hypertension is. Hypertension is elevated or high blood pressure. Every time your heart beats, it works to pump blood all through your body through your arteries. The higher the blood pressure in your body, the harder your heart has to work. When the force of blood going through your body is high, the artery walls can get stretched past healthy limits, and this is when problems start to occur. Blood pressure is described by a ratio in millimeters of mercury. The top number in the ratio is called the systolic number. This number represents the pressure in the arteries when the heart contracts or beats. This number should be the higher of the two numbers in the ratio. For a normal systolic reading, the number should be somewhere less than 120. For stage 1 hypertension, the number will be somewhere between 140 and 159. Stage 2 hypertension is a reading of 160 or higher. Any reading over 180 is hypertensive crisis and is considered a medical emergency. The bottom number of the ratio is called the diastolic number. This number is a measurement of artery pressure between heartbeats. At this time, the heart is at rest and is refilling with blood. A reading is considered normal if it is less than 80. Stage 1 hypertension is between 90 and 99. Stage 2 is a reading of 100 or higher. Hypertensive crisis is any diastolic reading over 110 and is considered a medical emergency. Hypertension is known to be a silent killer. This is because it is a symptomless condition. Many people make the mistake of assuming there will be some kind of alert or warning sign of a high blood pressure problem, when in fact, the only way a person will know there is a problem is to have their blood pressure checked. This is why it is important to do so regularly. There are several myths that claim to be signs of high blood pressure, and one must not be fooled. The first is headaches. It used to be assumed that headaches were common in people with high blood pressure, but current research says otherwise. In fact, people with high blood pressure have been known to have fewer headaches than the normal population. The second myth is nosebleeds. Although some people in hypertensive crisis have reported nosebleed symptoms, the findings are inconclusive. There have been several other people in hypertensive crisis that did not have nosebleed symptoms. Facial flushing is when the blood vessels in a person's face dilate and the face becomes red. This type of flushing can occur as a result of many things, some of which may include exposure to cold weather, eating spicy foods, exercising, alcohol consumption, and several other factors. When this occurs, it also temporarily raises blood pressure. Therefore, blood pressure may be high during this time, but it does not cause the facial flushing. Lastly is dizziness. While dizziness is not a result of high blood pressure, it can be an effect of some blood pressure medications. It is important to pay attention to dizziness as it may be a sign of stroke, which high blood pressure increases the risk for. Hypertension is diagnosed by a healthcare professional. This is done in a number of different settings, such as a healthcare office, a nurse's office, health fairs, or clinics. Blood pressure is taken by using a blood pressure monitor. A rubber cuff gets placed around the upper arm and it is inflated to compress the large artery in the arm. This compression temporarily stops blood flow, and then the cuff is slowly decompressed as the machine measures the blood pressure in an electronic readout. Blood pulses through the artery and is registered by the machine up until pressure in the artery exceeds the pressure of the cuff. There are 76.4 million U.S. adults that have been diagnosed with high blood pressure. This is significant because it can lead to heart disease and stroke. Heart disease is the #1 cause of death in the United States. Stroke is the third leading cause of death. There are several factors that put people at risk for hypertension. One of these risks is family history. If a family has a history of high blood pressure, future generations are likely to develop it as well. Age is also a factor. As people get older, the blood vessels in the body become less flexible, which can cause increased blood pressure. Gender may also be a risk. Research has shown that until age 45, more men have high blood pressure. However, after age 64, more women do. Generally, high blood pressure is more common in women. Lack of exercise is also an important factor. Being active is good for the heart and circulatory system, and being inactive leads to obesity, which is another risk factor for getting high blood pressure. Diet can be associated with hypertension. Diets with too much salt cause the body to keep excess water, which makes it harder for the heart to work. Obesity is related to hypertension because excess weight puts a strain on the heart, and it also elevates cholesterol levels. Alcohol consumption also has an effect on hypertension as it can cause heart failure, stroke, or irregular heartbeats. Some plausible but not proven factors include stress and smoking. Both of these cause a temporary increase in blood pressure, but they have not been proven to cause hypertension. Some problems that are related to hypertension include heart and artery damage. These are things such as heart failure, heart disease, heart attack, or atherosclerosis, which is a fatty buildup within the arteries. Also stroke, because high blood pressure can damage and weaken the arteries in the blood supply to the brain. Kidneys can also be affected as they are filled with arteries. The arteries within the kidneys cannot filter blood as well. Lastly is hypertension can affect vision in regards to blood vessels in the eyes and optic nerve. Despite the risk of getting high blood pressure, it can be prevented and managed. This can be done by watching diet, reducing the amount of salt, managing stress, staying active, and maintaining a healthy weight. Also by limiting alcohol and tobacco use, as well as complying with any medications that have been prescribed. Hypertension is a significant problem in the United States. It is associated with heightening the risk for some known deadly diseases. However, along with education and the right management techniques, this problem can be prevented.